Good afternoon. My name is Dr. Eric Toring. I'm the Senior Vice President for the American College of Veterinary Preventive Medicine, and I want to welcome you to today's webinar. The webinar today is sponsored by the American College of Veterinary Preventive Medicine, the American Association of Food Safety and Public Health Veterinarians, the National Association of Federal Veterinarians, the U.S. Animal Health Association, and the National Association of State Public Health Veterinarians. So with that, I would like to introduce today Dr. Tori Moore. Dr. Moore served as the CDC Epidemic Intelligence Service Officer at the South Carolina Department of Public Health from July 2023 to February 2025, where she was a disease detective investigating outbreaks of illnesses and injury across the state. She worked in large animal clinical practice and for the U.S. Department of Agriculture, FSIS, prior to her role at the CDC. She now serves as the veterinary medical officer in the rickettsial zoonosis branch at CDC and is a lieutenant commander in the U.S. Public Health Service. She attended veterinary school at the University of Georgia and received her master's in public health from the University of Missouri. Dr. Moore is passionate about integrating clinical veterinary skills with expertise as a public health leader and epidemiologist to improve the health and wellness of people and animals. Welcome, Dr. Moore.
Thank you, Dr. Toring. I'd like to thank everyone for joining us here today. I worked on a lot of different outbreaks when I was the EIS officer in South Carolina, but some of the most challenging and interesting for me as a veterinary epidemiologist were those concerning Brucella canis. So today I'm going to talk a little bit about some of those challenges we faced throughout our investigations and the lessons we learned along the way. So picture this. It's 4:30 on a Friday, and it's been a rough week at the state health department where you work as an epidemiologist. You're looking forward to tossing back a couple of frosty brews with the coworkers to blow off some steam when you get a call. A local veterinarian has reported to the Department of Public Health that a client's dog has tested positive for Brucella canis on a screening test, a zoonotic illness. The local vet is worried, rightfully so, about staff and owner exposures, and they're not quite sure what to do about testing for this dog. You don't know it now, but this is the first of many such investigations you're going to perform over the next several months. You know those frosty brews are going to have to wait tonight because you've got to interview the dog's owner and the veterinarian to determine if other people or animals have been exposed. So, you start by interviewing the dog's owners. Let's call this dog Goldie. Now, Goldie's owners noticed that she seemed uncomfortable, like maybe her stomach hurt, and that she had a reddish vaginal discharge. So they took her to the local veterinarian. The local vet shared her exam and history findings with you. You learned that she is a 4-year-old female spayed golden retriever and that she came from a puppy mill. She was surrendered by her previous owners according to the rescue. She does not have a spay scar or a tattoo, and there are no veterinary records from the rescue. Big shocker. She's bright and alert, and her TPR is normal. But her abdomen's a little tense. She does seem uncomfortable, and she's got some mammary development, but no milk. She has a bloody vaginal discharge, but no odor. CBC and chemistry are within normal limits, and she's got a few red cells on that free catch urinalysis. So the veterinarian decides to take some abdominal rads, which he shares with you. And surprise, Goldie is pregnant. The owners are shocked because the rescue told them that she had been spayed. So the owners are put on puppy watch. The veterinarian reports that Goldie's first puppy was delivered stillborn at home and that this was a late-term puppy. She birthed 4 more late-term puppies at the veterinary clinic, all of which died shortly after birth. Now, at this point, you're getting worried. You're starting to put together the clinical signs and history and the screening tests on this dog, and you're thinking this really might be canine brucellosis. But we all know this isn't the only cause of infertility in dogs, right? Canine brucellosis up there at the top, but we've got canine herpes virus, Neospora, cryptotoxo, those opportunistic bacterial infections like E. coli and Salmonella. You could be really unlucky, have a dog with a reproductive neoplasm, any acquired or congenital malformation, and then the ever-present management issues associated with the breeding of dogs. So while you're mulling over your differential list, you're also trying to piece together the traceback investigation on Goldie. You determine after speaking with her owners and the veterinarian that she had been transported across the state and that she had exposed 17 people and 5 pets before she had her positive test. So, what to do about all these exposed people and pets? You're thinking this is going to be a long night. We've got lots of questions to ask, right? How are we going to confirm this diagnosis? What should we tell the vet and the owners about this dog's prognosis? What public health message do we want to deliver to the veterinary staff and the owners about this disease? And how are we going to assess these people who are exposed and the pets who've been exposed? But before we spiral out of control and get carried away with all the what ifs, let's start with the basics. Brucellosis is a bacterial disease that can be spread from certain species of animals like dogs, cattle, swine, and sheep and goats to humans. Brucellosis is one of the most common zoonotic diseases worldwide. The exact burden of human disease is currently unknown, but estimates range between 500,000 and more than 2 million human cases annually. Unfortunately, many of these cases go unrecognized or unreported. Good news is, though, human brucellosis is rare in the United States. This is due primarily to vaccination of cattle and pasteurization of commercially available dairy products. So, how do people get brucellosis? Well, they can be exposed to infectious Brucella bacteria when they are in contact with contaminated fetal membranes or reproductive fluids, or by consuming unpasteurized dairy products or undercooked meats from infected animals. And hunters can be exposed if they're opening a carcass, field dressing a carcass, or consuming undercooked meat products from infected wild game. The CDC reports between 80 and 140 human brucellosis cases annually, with most of those cases in travelers abroad who visit brucellosis endemic areas and consume unpasteurized dairy products or undercooked meats. Important to note here that brucellosis cases in humans are a nationally notifiable condition, so it's required reporting. We've had 5 confirmed human brucellosis cases in South Carolina since 2021. So far this year, we've had 1 reported in the upstate region. Last year, we had 2 confirmed, 1 in PD, 1 in Low Country region. In 2023, we had 2 confirmed cases, both in the PD region. In 2022, we didn't have any reported confirmed cases. And then in 2021, we had a case reported in the Midlands region. So it's common to think about livestock when we're considering brucellosis. It's true that most people become infected through contaminated livestock and their products. But Brucella canis is the primary cause of brucellosis in domestic and wild dogs. It is a gram-negative intracellular bacteria with a rough lipopolysaccharide coat. And it's primarily transmitted sexually in dogs. Brucella canis is uncommon among brucellosis cases and is considered an emerging zoonotic threat. People can get Brucella canis from contacting contaminated canine bodily fluids, especially reproductive fluids and aborted materials. But it can also be transmitted through contact with infected blood, urine, or even saliva. The people most at risk for Brucella canis exposures are those with an occupational risk, like veterinarians, dog breeders, animal and shelter workers, and of course, laboratory personnel who may be manipulating those samples. The presentation of brucellosis in humans can be mistaken for other diseases because the signs and symptoms can be nonspecific and can include fever, joint pain, fatigue, and night sweats. But illness can be debilitating, with some persons experiencing severe chronic infection, including endocarditis, splenomegaly, and neurological symptoms. Symptoms of brucellosis in dogs are generally reproductive and include infertility, late-term abortions, and weak puppies. Males can experience orchitis, prostatitis, and epididymitis. Other signs and symptoms are nonspecific and can also be mistaken for other diseases. These include generalized lymphadenopathy, weight loss, uveitis, and discospondylitis. And lastly, some dogs can carry and spread the disease asymptomatically. Brucella canis is more common in stray dogs and dogs raised in kennel environments. The reason for this is that these dogs have close contact with one another, and there is increased breeding in these populations. There are no requirements for Brucella canis testing prior to interstate or international movement of dogs. This means that the prevalence is likely to increase as the movement of dogs across state and international lines increases. So we know that brucellosis is a reportable condition in humans, but how about a reportable animal condition? Well, reporting actually varies pretty widely by state. Some states don't require reporting at all, others do, and some only require under certain circumstances. So let's take a look at a couple examples here to give an idea of the breadth of reporting requirements across the United States. Let's take Montana, for example. In Montana, Brucella canis is a reportable animal condition. It is listed separately from the livestock species Brucella, so it's its own reportable condition. And there are specific testing recommendations and control guidelines provided by the state. How about Georgia, where I'm from? Well, interestingly, in Georgia, Brucella canis is reportable by any person who makes a clinical or laboratory diagnosis of Brucella canis in an animal purchased from or residing in a state licensed facility. So this might include a kennel or a shelter, a boarding facility, something like that. How about South Carolina, where all of our investigations took place? Well, Brucella canis is not a reportable animal condition in South Carolina, which is funny given all the cases that actually get reported to us in the Department of Public Health. So how does this even happen? Well, veterinarians call with questions about the condition. They're not sure whether it's reportable, not sure what to do about exposures in people and other pets. They call the state veterinarian's office. The state veterinarian says, sorry, this is not a reportable animal condition in South Carolina. But since people have been exposed to a zoonotic illness with potentially devastating effects, it is turfed to the Department of Public Health. So that is how Department of Public Health ends up investigating Brucella canis cases in South Carolina. Fortunately, we haven't had any reported human cases of canine brucellosis in South Carolina residents. In fact, most are from Brucella suis, that's from contact with wild hogs and hunters in South Carolina. So let's think back to Goldie's case. See if we can pick out some details from her history and her clinical signs that are consistent with the risk factors and symptoms that we have just discussed for Brucella canis. We know that she came from a puppy mill, which means that she was raised in a kennel environment, and we know that dogs raised in kennel environments are more likely to become infected. She doesn't have a veterinary history or any records that we know of, so we don't know about her testing status, and we don't know if she's had similar reproductive issues before. She had a bloody vaginal discharge, which was not normal. She had late-term stillborn puppies and several more that were weak and died shortly after birth, pretty much the hallmark of Brucella canis. So Goldie's case is actually representative of the first canine brucellosis investigation that we did at the South Carolina Department of Public Health. But we had many hurdles to overcome because the Department of Public Health had not investigated any cases of Brucella canis in recent memory. And we didn't have the partnerships and these systems in place to handle these lengthy and complex investigations. We performed 5 separate Brucella canis investigations in about 12 months at the Department of Public Health. This represents a recent increase in investigations, considering we don't have any other reports of these types of investigations going back to 2017 when we started trying to record this type of data. So these investigations have implicated exposures in more than 30 people and more than 15 dogs. Now, take this with a grain of salt. The number of exposed dogs is likely to be much, much higher, but these are the ones that we could absolutely confirm on a traceback investigation. So the first question we want to ask at the Department of Public Health if we're investigating an potential outbreak situation is, how do we confirm these cases? We want to know that this is actually the disease we're dealing with here. Well, we have a strong suspicion that these dogs were infected because they had consistent clinical signs. Most of them had a positive initial screening test from their local veterinarian, but we needed to be sure because brucellosis is considered a lifelong infection and euthanasia is generally recommended for infected dogs. But what test should we select? What samples do we need? And where are we going to send these samples? And is there something else we need to know about testing for Brucella canis in dogs that's going to allow us to give the most accurate information to the veterinarian, the owners, and our public health partners? Well, first things first, when ordering a test for canine brucellosis, you should specify that you want a test for Brucella canis. Dogs can actually be exposed to and become infected with the livestock species of Brucella if they're around infected livestock. And laboratories more commonly run tests for the livestock species of Brucella than they do Brucella canis. You may be wondering why this is important, that we need to differentiate, but the distinction is critical because serological tests used to detect infection with other species of Brucella in dogs cannot be used for Brucella canis. The reason for this goes back to the morphological difference. So I mentioned that Brucella canis has a rough lipopolysaccharide coat, and the serological test meant to detect an antigenic reaction in the livestock species is based on a smooth lipopolysaccharide coat. So these tests actually are not interchangeable. So you don't want to make a mistake and order the wrong test in this situation. Brucella canis can be difficult to detect, and it often requires more than one test for confirmation. It's difficult to detect because it's an intracellular bacteria. It's great at evading the immune system. It has a tropism for reproductive tissues, which means it might not be hanging out in the peripheral blood when you go to take a sample. Even animals that are heavily symptomatic in the middle of an abortion tend to have limited bacteremia. And that bacteremia can be intermittent. And finally, it's a fastidious bacteria, meaning that it's really difficult to grow in a laboratory environment. So, under most circumstances, we're going to need two tests to support a diagnosis. So if we want to call a dog negative, we need two negative tests about 8 to 12 weeks apart. The reason for that is to account for seroconversion, which can take some dogs up to 12 weeks from the initial exposure. If we want to call a dog positive, we need to follow a positive screening test with some kind of confirmatory test to be sure. But y'all, there are so many tests available for dogs, and they all vary in sensitivity and specificity. But on the most basic level, we have two types of testing options available. The first is the serological or antibody tests, which we use for screening dogs, and these tests are usually run on serum. These tests generally have a pretty high sensitivity and a little lower specificity. That makes sense for a screening test, right? We're trying to catch all possibly infected animals in a population. The second basic type of test is a pathogen detection test, and we generally use these types of tests for confirmation of infection because we're actually looking for direct evidence of the organism in the dog's body. We can run these confirmatory tests on blood, tissue, semen, even a vaginal swab. So a little bit more flexibility on the type of sample here. All right, let's talk serological screening tests. What are we going to tell these owners? Like, we got to sort through all these tests and be able to give a decent recommendation here. So one of the most common tests you'll see out there is the indirect fluorescent antibody, or IFA. It's pretty widely available, generally pretty inexpensive, and it has good sensitivity and specificity, so it can be a good place to start for you. Most labs are able to perform an IFA for this. Next up, we have our tube agglutination test, or TAT. Nice thing about this one is it gives you a semi-quantitative result, and it has good sensitivity as well. Next, we've got the rapid slide agglutination test, or RSAT. It's pretty quick and cheap to run, very few false negatives, which is nice because we're trying to catch all potentially infected animals with a screening test. Then its close cousin, the 2-mercaptoethanol RSAT, has even better sensitivity and specificity above the traditional RSAT test. Now remember, we're talking screening tests here, so we want to follow these up with some kind of confirmatory test. All right, next up for serological tests, we've got the enzyme-linked immunosorbent assay, or ELISA, and our agar gel immunodiffusion assay, or AGID, AGID. These two tests are less widely available currently and more expensive. They require a lot of special equipment and reagents to run, special training for folks to be able to perform these effectively. But they both are highly sensitive and specific. So in a pinch, they can be used as a confirmatory test when you don't have another option for confirmation. Next, we've got the canine Brucella multiplex, or CBM. This is run by Cornell University's Veterinary Diagnostic Lab. And nice thing about this one is it's a quantitative test. So it's best used at the current time in a symptomatic animal to confirm a diagnosis, or when you're trying to monitor response to treatment and you want to see that antibody trend over time. Last up on the serological screening test, we have the lateral flow assay, and I've got this one in red because I want you to stay away from it. The reason being is one, not widely available at this point in time. And two, it has low specificity in a lot of scenarios, which means a positive test might not mean too much. So if you're able to pick another choice on the list, do that instead. All right, that was a good many screening tests available. What about pathogen detection tests? Remember, with these, we're looking for evidence of the actual organism in the dog's body. Ah, thank God there's only two options here. Culture and polymerase chain reaction, or PCR. You guys are familiar with these. Old standbys here. If we find the organism in the dog, we know the dog's infected, right? Culture is still the gold standard for Brucella canis diagnosis, but can produce false negative results for all of those reasons I previously mentioned that make it difficult to detect. It's fastidious, hard to grow in the lab, low bacteremia, loves to evade the immune system, hanging out in the reproductive tissues, tough to get a sample and find it. All those types of reasons make these false negatives more commonplace on a culture than we'd really prefer. And let's not forget, Brucella species bacteria are also hazardous to work with, requiring a BSL-3 level laboratory for culture. All right, we've sorted through the types of tests available. How about the best samples to take? Well, if we've got a symptomatic animal like the ones that we've had throughout our investigations, the best samples to take are serum and reproductive fluids or tissues. Reason for this is since that bacteria has a tropism for reproductive tissues, a symptomatic animal is going to be dumping lots of bacteria into those tissues, into those fluids, and those are going to be the best, most diagnostic samples for us. So we're talking vaginal swab, placenta, aborted membranes, semen sample, and fetal liver and spleen all make good samples in terms of reproductive fluids and tissues. But what if we've got an asymptomatic dog? Maybe it lives with an infected animal, right? And we're just screening it, or it has had some symptoms in the past, but maybe is doing okay now. Um, Generally, the best sample to take is serum, and most of the time, it's the only sample you can take in an animal that's asymptomatic. But if you're able to catch a vaginal swab or a semen sample on an asymptomatic dog, that can also help you get a more accurate diagnosis in that scenario. So, it's all well and good to talk about an individual dog, right? We had to follow up testing on Goldie to make sure that she was infected, and she was. But we can run into situations where we've got whole kennels or even a breeding operation that we're suspicious that these animals are infected and potentially infecting other dogs as well. Well, this actually happened in South Carolina. We had a backyard breeder operation who was breeding and unknowingly breeding and selling infected dogs all over the place. So in this situation, we want to test all dogs 6 months of age and older. We want to do that once a year to make sure nobody's seroconverting. If we find a positive dog, we want to isolate them and confirm that diagnosis. And any dogs that are leaving the premises on a regular basis, we want to test them more frequently to make sure they haven't picked up the infection elsewhere. And then if you're unlucky and you do have a kennel or a breeder situation where there are positive animals, we need to perform repeat testing and we need to remove the infected dogs from that population. So we're talking tests for all these animals about every 4 weeks or so until we get two negative testing sessions for those animals in order to call that kennel brucellosis free at that time. I know this is basic, but it warrants mentioning, especially if you're speaking to clients or other public health professionals about this disease. Good cleaning, disinfection, and biosecurity are always important for preventing spread between dogs and also to people. So we've talked about testing. We discussed that euthanasia is generally the recommended course of action. But what if an owner refuses euthanasia? Or maybe they're just willing to live with the risk of having a dog in the house that has this zoonotic illness. Well, we can try long-term antibiotics, but this does not guarantee a cure. We're looking at 2 to 3 months of treatment for these dogs, and they're going to be on at least 2 antibiotics during this time. Relapses are common in dogs, can get really pricey, y'all, especially if you've got a medium or large breed dog that's on uh, 2 or more types of antibiotics for 3 months. And we're also going to need to, test that dog throughout its life to make sure that we haven't had a relapse or that that dog hasn't seroconverted at some point in time. And lest we forget, long-term antibiotic use can cause some pretty nasty side effects. So, if you're perusing the literature, trying to figure out what you're going to treat this dog with, you're not going to find much of a consensus. That's because the recommended course of action is euthanasia. But if you're sorting through the papers, you'll see that most will recommend treatment with a tetracycline antibiotic like minocycline or doxycycline in combination with a second antibiotic, a fluoroquinolone, for example, like enrofloxacin, rifampin, or possibly an aminoglycoside like streptomycin or gentamicin. What you'll also find if you do a literature search for this is that pretty much everybody disagrees on which combination works best for what situation, what the best dosing range is going to be, and the length of treatment for these dogs. So no clear-cut answer here on the polypharmacy antimicrobial course of treatment here. And intact dogs need to be sterilized. We are trying to reduce the shedding of this zoonotic organism into the environment, and we also want to prevent further breeding of these infected animals. Whew. So sorting through all the testing options is challenge enough when you're working at a Department of Public Health, but where are we going to send these samples? We're the Department of Public Health, not the state veterinarian's office. We generally deal with human samples in a public health investigation, not canine samples. So where are we going to send them? Well, fortunately, our state public health lab in South Carolina has a BSL-3 level lab, so we can send samples to them for PCR and culture. Lots of veterinary university labs out there are going to offer testing for canine brucellosis in no particular order of preference. Cornell offers the canine Brucella multiplex. UGA does a lot of testing. University of Georgia does a lot of testing for canine brucellosis, as well as KSU and Florida. Then you've got your commercial lab options, IDEXX, Antech. Nice thing about these guys is if you're trying to narrow down a diagnosis, you're not quite sure it's canine brucellosis, got some other mixed symptoms in there, you can actually run an infertility panel, try and narrow down your options there. So where do we send our samples at the Department of Public Health for our outbreak investigations? Well, we partnered with the state veterinarian's office who connected us with Clemson's Veterinary Diagnostic Laboratory at the Livestock Poultry Health Center. They were able to run low-cost indirect fluorescent antibody screening tests for us for dogs involved in public health investigations. In our fabulous public health laboratory, God bless them, able to run culture and PCR for us in that great BSL-3 level lab at no cost for dogs involved in public health investigations. So the dog testing was one hurdle down, but what about testing for all the humans that were exposed to infected dogs? We're talking about the family, the friends, the veterinary staff, the laboratory personnel even, that manipulated samples perhaps without knowing what they were really dealing with. Well, guys, this is another fence to scale because there are no approved serological tests for Brucella canis in humans, making case identification very difficult. So instead, we rely on symptom monitoring and post-exposure prophylaxis antibiotics, or PEP. We recommend symptom monitoring for 6 months. The reason for this is that people have been known to develop symptoms of brucellosis up to 6 months after the initial exposure. Again, Brucella is really great at hiding inside the body, evading the immune system. And so it can take a long time for someone to show symptoms from an exposure. But this can get tricky when you've got lots of people to monitor, and especially where you have overlapping investigations like we did in South Carolina. For example, we had 17 people who were exposed in Goldie's first investigation that we performed. And three of those people had high risk exposures that required antibiotic PEP. So we needed to check in with these folks to make sure they were taking their PEP, they weren't experiencing any of those nasty side effects, and that no one else was developing symptoms during this time period. Problem was, we didn't really have a way to keep track of symptom monitoring, especially with all the overlapping investigations over that 12-month time period. So we created a program in REDCap with help from our informatics team to track symptom monitoring and reduce the number of callbacks, emails, texts that our staff members had to perform to keep track of everybody who had been exposed. This program was a big hit. We actually extended its use to all brucellosis investigations in the state, not just those involving Brucella canis. And we also modified a version of it to track symptom monitoring in folks who had been potentially exposed to bird flu. We also had to adapt our outbreak reporting system to include canine cases and linked human exposures. This was a problem because before we modified our outbreak reporting system, we didn't have a place to store our laboratory data from these dogs that we were testing. And so once we made these changes, we were able to securely store all of this information in one location where everyone at DPH who needed to see this information could find it in one place. No more scrolling through crazy long spreadsheets and email chains to find the information we needed for these investigations. So the next hurdle was to establish who had high risk exposures and needed antibiotic PEP. But what constitutes a high risk exposure for Brucella canis? Well, problem is there are no written guidelines available for assessing risk in persons exposed to Brucella canis. Now, CDC has this nifty brucellosis reference guide, which has a lot of great information in there. But the guidance for Brucella exposures are based on laboratory exposures, not reflective of what we were seeing in our field investigations. So it didn't really cover the unique exposures encountered with canine brucellosis. So what did we do? Well, we actually designed a guide for assessing risk in South Carolina based on those general guidelines as a starting point, our experience during investigations, and with the help of CDC subject matter experts. So this served as our starting point for assessing risk during these investigations. The next challenge to overcome was that many of the exposed persons with high risk exposures did not have a regular primary care physician or health insurance. Guys, this meant that we were having trouble getting antibiotic PEP to the people who needed it most. So we worked with our grant specialists to fund a program for people who needed antibiotic PEP and could not afford it as part of a public health investigation. So they could go and pick up their antibiotic PEP from their local health department with an order signed by a DPH medical officer. And we also connected them to a primary care physician in their area. If they developed symptoms, they knew where to go. And that physician knew to give us a call at the DPH if that person presented to the office with symptoms. So we had to scale a lot of fences to get here. We tackled a lot of challenges related to testing, risk assessment, data storage, and even PEP administration, but we knew our work was not done. We knew that we needed to address the educational gaps that we identified for veterinarians and physicians throughout these investigations. So for vets, we focused on risk communication and testing for dogs to prevent spread between people and to humans. These were the two issues that veterinarians had the most questions about. We wanted to be sure that vets could communicate the risk of Brucella canis to clients clearly and effectively. This meant that they needed to include that this was a zoonotic illness, that children, the immune suppressed, and pregnant persons might be at an increased risk for infection, that it's transmissible to other dogs, that there's no vaccine available, which means that prevention methods and using the right personal protective equipment, or PPE, is extra important, and that breeders should beware of the ethical and legal consequences of breeding and selling dogs who are infected. Our message for vet staff was pretty clear. If you want to reduce the risk for you and your staff, you got to wear the right PPE. So gloves, mask, gown, eye protection, anytime you're suspicious an animal is infected with this Brucella canis, and especially dogs experiencing infertility or abortion. There is very scant information out there on Brucella canis from a public health perspective. So we published a, a version of this information about our first investigation in CDC's Morbidity and Mortality Weekly Reports, MMWR. And we had some recommendations for vets in this article. We wanted vets to keep Brucella canis on the differential list, especially if they're dealing with a dog that has infertility or abortion issues. Got to use the right PPE, especially if the dog is having trouble during delivery, experiencing abortion, anytime you are suspecting this illness. Must communicate the risk effectively to staff members and clients. And you got to know your state's reporting requirements, whether you got to call somebody and tell someone about this disease that you've found or not. We've done our best in South Carolina to disseminate this information to the veterinary community as widely as possible. This has included reaching out to our Veterinary Medical Association in South Carolina, publishing articles in their newsletter and on their website, speaking at Palmetto Veterinary Conference, which is the big conference, vet conference in South Carolina. I spoke on this topic at AVMA and to some of my fellow public health service veterinary officers as well. Now, for physicians, it was a bit of a different story in terms of education. We focused on disease awareness, history taking, and the testing pitfalls with Brucella canis. So we gave timely presentations and explained how to report cases of brucellosis, which tests are available, and the history and symptoms that could be consistent with brucellosis. But the major challenge we faced with educating physicians so far has been the testing pitfalls. I mentioned previously that there is no approved serological test for Brucella canis in humans, and that's true, but there is one available for the livestock species. So physicians were unwittingly submitting a test for brucellosis, thinking that it had automatically included Brucella canis, when in fact it did not. They were only testing for the livestock species of Brucella. They would report these test results as negative to their patients when in fact they had not actually tested the patient for Brucella canis. So closing this educational gap has been a priority for us at the DPH. We decided that we needed a place to put all this great information that was easily accessible, so we created a public-facing website that contains resources and links for further information for healthcare providers, vets, and the public. We also created a series of plain language fact sheets for the public in both English and Spanish, which are easily accessible from links on the website or by request through any one of our health department offices. The main thing here was that we wanted veterinarians and healthcare providers to know that they could call us if they had questions about this disease. We could evaluate exposure risk, make recommendations for antibiotic PEP, and connect people to services if they needed it. We have a lot of partners in this truly One Health approach to these investigations. Lab partners in South Carolina, Clemson, and our state public health lab, the state vet's office, CDC, the veterinary medical and medical associations, and also the Department of Natural Resources have all been integral in these investigations. So what else are we doing about Brucella canis cases in South Carolina? Well, I mentioned that we had 5 investigations about 12 months. I think we're probably up to, I don't know, 8 or so now. So the questions keep coming, but we're going to investigate every report we receive because we want to be sure that all people who have high risk exposures receive the antibiotic PEP that they need. We're going to continue to build these partnerships throughout the state and nationally. We want to be sure that veterinarians and physicians are educated about this condition. And lastly, we're going to continue to improve, tinker with, tweak our ability to track cases and exposures. So while we've had a lot of hurdles to clear at the DPH with these investigations, we have so far accomplished a favorable outcome by working with our partners and building a One Health interdisciplinary approach to these investigations. I would like to specifically thank our regional epidemiology team members who have done such a fabulous job with the kind of boots on the ground aspect of these investigations, like picking up the blood tubes and the samples and transporting them and calling people, performing interviews. They are kind of the brick and mortar that holds these investigations together. And I'd also like to give a big thank you to the Bacterial Special Pathogens branch at CDC, who has contributed a lot of expertise, information, and help for us in South Carolina throughout these investigations and in preparing this presentation for you today. If you have questions about this presentation, give me a holler. My email address is up there in the right-hand corner. Aside from that, I appreciate your attention, spending some time here this afternoon to hear a little bit about our challenges and our lessons learned here throughout these investigations. And I'd be glad to take any questions. Dr. Torin?
Thank you, Dr. Moore. So with that, we'll go with some Q&A that have accumulated. There are quite a few questions here. These I'll just kind of start going in order of how the material was presented. An attendee asks, for the 5 cases in South Carolina, what Brucella species were they infected with? Suis, Canis, Abortus, Melitensis? And did you
Yeah. For the 5 confirmed human cases in South Carolina, the majority have been Brucella suis in hunters who've had exposure to infected feral swine while hunting. So they're field dressing a carcass or they're handling uncooked meats, consuming uncooked meats, and they end up with Brucella suis, unfortunately.
do you know how, you know, well, you just said how they were infected. It was obviously a local source. It wasn't internationally acquired.
Correct.
Uh,
Most of the cases that we see in South Carolina are acquired locally through contact with infected feral swine.
okay. An attendee asks if you have any information on the prevalence of Brucella canis in the U.S., or if there are any studies on prevalence that you're aware of.
Yeah, give me just a second. I have a slide I can show you on that. Okay, hopefully you can see that. Um, I shared this map of seroprevalence with you. Um, and I want you to take it with a grain of salt because there are actually very few seroprevalence studies on this disease in dogs. This condition was first discovered in the late 60s, early 70s in like a kennel of beagles in the northeastern United States. And so most of the studies on seroprevalence were done during like the 70s and 80s. And let me tell you, some of the analysis and the testing methodologies were pretty dubious. You can see from this map here of seroprevalence data across the United States and some other places where serosurveys have been done, that the United States has like a 5.6% seroprevalence in dogs. But this is only based on 5 studies that have been weighted. And there seems to be some kind of bias to the southeastern United States, but it's unclear whether there are more dogs with a higher seroprevalence in the southeastern United States or if it's a study collection bias and there's just been more studies in the southeastern United States. Um, so very few reliable published seroprevalence studies in the United States. Each one of these dots represents a seroprevalence study that was performed in a certain region. You can see the United States, again, we don't have many. Only 12 have been performed and have enough legitimacy to be included in this meta-analysis paper.
Okay. Um, Looking through here, are you aware of any differences in B. canis in the U.S. and other countries? Are there any uh, uh, genomic differences in isolation?
Not that I'm aware of, but I'm not a genomics gal, I'm more of the 30,000-foot epi, so that would be a better question for a genomic epidemiologist.
Okay. Um, for B. canis serologically positive spayed or neuter dogs, is there any risk to humans?
Yeah, there is still a non-zero risk that that animal is shedding into the environment and that that bacteria is still present in blood, saliva, urine, and feces. So if you have an animal that's tested positive and you sterilize that animal, there is still um, a chance that that animal is able to pass it to a person.
Okay. A couple questions about the monitoring. An attendee asks, how successful was the symptom monitoring using REDCap when compared to active follow-up via telephone calls? Did people get lost to follow up when REDCap was adopted?
We had pretty good responses to RedCap. I think what people didn't really love was us calling them from the DPH every week and harassing them. Like they seemed to almost prefer being emailed or texted about it. Like they could just tap a response on their phone or through their email. It did certainly cut down on the amount of callbacks and staff time that we did. I didn't hear any folks say like, "Oh, we'd rather have a direct phone call from you guys." Now, if someone said, "Oh, I have been experiencing symptoms," then they were going to get a phone call from us, right? Because they had marked that they were symptomatic. But it seemed to work really well. We did not have any people who uh, became symptomatic associated with Brucella canis over that 6 month time period. We had people who got sick. We had people uh, who we had momentary meltdowns about because they had fever and they had night sweats and chills, but it ended up, they had flu or COVID or something like that. And we were breathing a sigh of relief that they didn't have Brucella and it was just a cold or something. So, and we did have some folks who were immune compromised, and we were keeping extra close eye on them and in contact with their physicians as well.
Okay. And are there any different clinical signs in humans with different species of Brucella? Does Brucella canis present differently in humans than Brucella suis?
No, the symptoms of Brucella are pretty consistent across the species. There is some literature out there that suggests that disease with Brucella canis is perhaps less severe than that with Brucella abortus or militensis, for example. Militensis is known to be like particularly nasty in people, but there are plenty of reports of folks, becoming debilitated with Brucella species. The problem is it overlaps with many other disease constellation of symptoms in people, especially in areas with the highest prevalence. It overlaps symptom-wise with other diseases like TB and malaria. And so, those things, fever, night sweats, chills, muscle pain, and so it gets missed a lot. But, pretty consistent across the board in terms of the types of symptoms that you see.
Okay. A couple clinical practice type of questions.
Mhm.
Do you have any recommendation if a screening test is positive, but the confirmatory test is negative for a suspected case in a dog?
Yeah, that does happen. If the dog is symptomatic and you have a positive screening test, like that's pretty strong evidence. You want that confirmatory test to be sure, especially if you're considering euthanizing that animal. My recommendation would be to test that animal again in another month or two and see if you get a different answer on that additional screening test or confirmatory test. It can be tricky. It's so hard to pick that bacteria up sometimes, and it can take time for dogs to seroconvert, and there can also be cross-reactivity between other bacteria on serological testing. So you really want those two tests to line up nicely. They don't always. I'd recommend calling your state animal health official or something to help you sort through that if that's the case for you.
Okay, and kind of along the same lines, if you do have a positive test and the owner wishes to keep that B. canis positive dog,
Mhm.
is there any advice on how to manage that dog in the house, the neighborhood, etc.?
Hmm. Yeah, I mean, in a perfect world, we'd want that dog to be isolated from all other dogs, right? And anytime that dog is going to be hanging out with people, those people should ideally be aware of the risk, especially if they're immune compromised or pregnant or elderly, etc. I know that's a tough conversation to have, and one you'd have to have with the client, um, knowing what kind of interactions that dog typically has. But I'd certainly try to keep that dog away from other dogs. Like I probably wouldn't be trying to take it to the dog park, or the groomers or whatever, knowing that that animal is potentially infectious.
Okay. And then finally, do you have any thoughts on interstate screening requirements for B. canis, for movement of dogs, sales, dog shows, etc.?
Yeah, I think it's not required by law. Like Uncle Sam is not going to get you because you haven't tested your dogs for Brucella and you're going to a show, right? But I think it's ethically the right thing to do. And the American Kennel Club does not require it for their breeders to actually test. It's actually mentioned on their website as a test that's like highly recommended to do, but it's not required. Um, if it's me and I learned that a breeder client is going to be taking dogs to a show or selling dogs across the state line, I would probably recommend testing as part of your overall um, health and biosecurity program for that particular group of animals. Like, again, you can't force someone to do it, but you can present that as a best practice.
Okay. We're going to make this the final question. First of all, the attendee says great presentation. Uh, and in your presentation, you noted B. canis as an emerging zoonotic threat.
Mhm.
How is an emerging zoonotic threat defined, and what factors contribute to the classification of such?
Yeah, so this is a disease that's it's fallen by the wayside because most commonly diagnosed um, cases of brucellosis are from livestock. Um, Someone can have exposure to an infected dog, be tested using a livestock serological test, and be negative, and then no one know that that dog was potentially exposed to an infected dog and got it from an infected dog. Um, there are a number of papers out there that describe this scenario and the importance of this disease as an emerging threat, which I'm happy to provide references for if that individual would like to shoot me an email.
I think we're going to close out the Q&A. If you can put that last slide up so folks can see your email if we didn't get
Yeah,
to your
sure.
question.
Missed
Um,
it.
you can email Dr. Moore. But I would like to definitely thank you, Dr. Moore, for a very engaging and enlightening discussion today on brucellosis. And the ACVPM could not do this or run this program without volunteers like you. So definitely appreciate it. I'm looking at the Zoom screen here. I see confetti, hearts, clapping hands. going up. So I don't think I'm alone in my, thanks for giving a great presentation. Uh,
Yeah, you're welcome. Super glad to be here. And yeah, like I said, if you got any questions about what's going on in South Carolina, shoot me an email.
So, and as I said, if we couldn't do it without volunteers like Dr. Moore, if anyone is interested in providing a presentation such as this to our webinar program, you can email me and I can get that into the hands that you're volunteering into the hands of the ACVPM Continuing Education Committee. There's also a page on our website under the Continuing Education tab where you can volunteer uh, through our website to provide a presentation. So consider that for you ACVPM diplomates that are 2016 and later. Uh,
Mhm.
Presenting things like this does help in accumulating your maintenance of certification points. So there's a little added plus for doing so. So again, I want to thank you, Dr. Moore. Great presentation. I want to thank everyone for attending. Keep an eye out in the next couple days for an invitation to our next CE webinar. Should be, I believe it's the end of September. So with that, I want to wish everyone a great afternoon and evening, and thank you again for attending.
Thanks so much, guys. Appreciate you.